We are answering your coronavirus questions with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. And you can see the number at the bottom of your screen to get your text question so that we can ask her about it. All right, we're going to go to the queue. This person says, what is the right amount of time to wait to get a COVID test if you were exposed to someone who tested positive?
So we generally recommend to get tested between day 5 and day 7. And then if you actually get tested on day 7 and it's negative, you only have anywhere from 5 to 10% chance to convert thereafter. So at day 7, it's fairly accurate.
Okay, and so if you do test positive, then what happens?
So for folks who test positive, regardless of being symptomatic or not, you need to stay in isolation for the next 10 days. And that's the common rule among all the health departments. And then they'll start contacting you to let your other contacts know to get tested after being with you. And we don't really recommend people to get tested again. The reason being is that you can have a positive test after your initial one for anywhere up to 3 months, we see in some people. But it doesn't mean that you're infectious. So it's really, after you have a positive test, you stay home for 10 days. And as long as you have at least 1 day of improvement, after that 10 days, you're released from that isolation phase.
Mm-hmm. Okay. This person says, do we need to wipe down our groceries? Can you catch COVID from things that you purchase at the store?
So, in the beginning, we didn't really know where and how contagious SARS-CoV-2 was. So initially, I think we did feel that what we consider fomites, like anything that gets delivered needs to be wiped down. And that's not necessarily the case. We still recommend really good hand hygiene. And then obviously wearing a mask. If anybody's like coughing near you, that's the concern of that exposure.
So here's an interesting follow-up question. The person says, I understand using hand sanitizer and wiping down surfaces often, but doesn't this virus spread from when you breathe? Why do we care about the hand sanitizer and things as much if it's done by our breath?
Well, I think it's really more, I think at times is what, in the beginning, I remember when I was a kid, I'd covered my cough, but I'd covered with my hands, right? And so coughing into your hands, right? That's where the contamination occurs. So hand hygiene has been part of infection prevention for hundreds of years. So it's always important, but it's more of it is a droplet, potentially sometimes aerosolizing transmission base for contracting SARS-CoV-2.
So someone's asking, with so many people wearing masks that I see now out and about, why are the numbers still going up?
It's really what people are doing outside of you seeing them wearing a mask, It's especially what's happened over the holidays. Folks were saying, well, I just spent it with my family, but then they find out that their in-laws came who live in another state and another set of family members. So that exposure isn't really just your household. All of a sudden you have 3 or 4 households that were with you, and you probably were not wearing a mask, and you were indoors for greater than 15 minutes in close proximity. So even though you may be doing your day-to-day errands, it's really that exposure from when people were together as in a celebration. And I think that's the part that's challenging, Yes. People, I'm sure, felt fine, right? And it's not until the next day you realize, oh, somebody out of the 12 were positive. And now all of a sudden, these 12 people have been exposed and are likely, can potentially still become positive.
Mm-hmm. There's a lot of issues surrounding the vaccine and people wanting to get the vaccine and then being duped into sharing information or money or something like that to get on a waiting list. This person's saying, will people 75 and older be contacted when they're allowed to get the vaccine? How do we know that we're allowed to get it?
That is a good point. I know I believe at many healthcare institutions, we are sending out emails, some sort of method of communication to say, yes, you're entitled to getting the vaccine because you're meeting that criteria, that 1B. And more information is to come to where to get the vaccine. So please don't get duped into saying that there should be information, as well as through health departments. Local health departments have also started their vaccine series for them.
Right, and you're never going to have to pay to get on a waiting list or any of that kind of thing. And if you ever have a question, if you get something from, XYZ place, you can call that place directly when you look up the number themselves instead of just clicking a link or taking what information is given to you. Thank you so much, Dr. Snyder, once again, for sharing your expertise on coronavirus. We always have a million and one questions, so thank you so much.